So you've decided that you want a custom facial implant, and you've made it all the way to this YouTube channel. You've maybe had a consultation with me, and you've maybe even paid a deposit for an implant design process. How then do we get from a CT scan to a model of a facial implant, and what is that going to mean in terms of your overall result? There's so much that goes into implant design. This is a process that can take weeks, and there can be 3-4 iterations of implant designs before we even send you a proposal. Why are we evaluating your face, and what are we using to evaluate your face to create models and to create the perfect, for example, jawline or chin projection based on CT scans alone? Where is this coming from? There's an entire field, especially in the oral maxillofacial surgery world, where we rely on something called a cephalogram, and we use a science called cephalometrics to actually measure certain aspects of your face based on bony landmarks. And yes, I can use these. I can use these as basic guidelines to create certain bony landmarks and configurations that would optimize, for example, an asymmetric jawline or an underprojected chin or weak jaw angles. But where are we putting the limits? Where do we stop, and why do we stop where we do? Where is all of this data coming from? There is a very large database collected over hundreds of years, based, starting from canons of beauty based on paintings and what, for example, Michelangelo would use to create some of his art. And we use concepts like facial thirds and facial fifths to basically draw a face, to teach somebody how to draw an attractive face. And I'm even using that in terms of guiding my designs, using anatomy textbooks, not for plastic surgeons, not for oral maxillofacial surgeons, but for sculptors, because this is a series of guidelines on how to construct something. But this alone will not make patients happy. There's no way in heck this would make patients happy. But one thing that I gleaned from this book is a single picture. And this picture from this book shows an overweight older gentleman. And in this photo, you can actually see what contributions you get from bone, muscle, fat, and cartilage. What I'm doing for you is looking at your bony skeleton. I'm looking at the bony contributions to your face and figuring out if there are any obvious asymmetries or shortcomings. And I would like to bring these closer to cephalometric ideals based on our understanding of the human face in males and females over the past 100 years or so. And this gives me some basis, in addition to my own clinical experience and my examination of you, on how we are going to achieve certain goals. And we get about 90% of the way there. It's not 100%. There is so much that goes into this in terms of soft tissue swelling, fat atrophy, compression of the soft tissues, that designing implants alone will not and cannot give me 100% certainty that I'm going to be able to achieve your goals, but we're getting closer. And so when I look at a patient, I evaluate them, I look at soft tissue contributions. A lot of times things like salivary glands or fat contributions or even facial hair will contribute to certain facial shapes and configurations. And then we can, and only then, we can evaluate how much of, for example, the masset or muscle or your bone is contributing to what you don't like about your face or what you'd like to enhance. Ultimately, there is no rule book, and that is where the art of plastic surgery comes into play. For example, it takes a tremendous experience with patients and understanding how patients turn out after 4 to 6 months. And we keep saying, trust the process as your swelling resolves, because we know how things are going to progress with time. But only you will determine after 6 to 12 months whether or not this is what you want. And most patients that I've treated, knock on wood, have been fairly happy. Having said that, there is going to be a significant larger experience, not only with myself, but amongst the community, where we are getting closer to being able to predict exactly how you're going to look. I have some very sophisticated patients that are sending me pictures and using certain guidelines and landmarks to try and design the perfect chin or jaw angles of their dreams. But realistically, it takes an artist to be able to sculpt you, both literally and figuratively, in terms of fat reduction, maybe skin tightening, and bony augmentation. And once we achieve all of these things, we will be able to design the implant of your dreams, but it still may not be perfect. As of today, I'm here to help you. I have at my fingertips, at my disposal, hundreds of pages of literature showing what ideal cephalometric norms should be. I have the experience of having augmented dozens of faces with custom implants. and I also have an artistic vision, and most importantly, I have the ability to listen to what it is that you want. Because at the end of the day, it's not about hitting a certain angle, it's about achieving your goals. If I feel it's safe and possible, I will lead you in that direction. Thank you so much for taking the time to watch this video, and these are my thoughts.